Assalamu alaikum wa rahmatullah. My name is Dr. Aliya Junaidy and I work as a general practitioner. First of all, Ramzan Mubarak to everyone, and may Allah bless all of us in the holy month of Ramadan. As a female GP, I regularly see the female cases in the day-to-day practice, and there is a huge variety of the female cases. But today I want to discuss about a very common female condition called as the polycystic ovarian syndrome, which in the common terms we call it as the PCOS, PCOS, and that affects the young girls and the women of the childbearing age group in a variety of ways, especially physically as well as mentally also. So first of all, what is the polycystic ovarian syndrome? That's we call the PCOS and the PCOS also. So it is the game of the hormonal imbalance. As a female, we all carry the androgen, which is the male hormone, and it is in our bloodstream in a very small amount. But in the polycystic ovaries, there is a huge production of the androgens, and along with it, there is an insulin resistance. And as we all know in the general terms, the insulin is the hormone which is very important to control the glucose level in the body, and if there is a deficiency or resistance of the insulin, in the long term it can cause the diabetes. How someone knows that she has the polycystic ovarian syndrome? So the symptoms vary a lot, some having very mild symptoms, some have very severe symptoms, but it depends from one person to another. So in the common scenarios, the most important symptoms that affect the self-esteem of a female, especially the young girls, is the development of the acne, the pimples on the face, the excessive hair growth, especially on the chin, on the side of the face, and they are thicker, darker hairs. There is a loss of the hairs from the scalp also, so that is definitely, as a female, is a very cosmetic challenge. Sometimes there is excessive production of the skin tags. There can be sometimes the discoloration on the back of the neck or in the armpits also. And the most important thing, there is a excessive weight gain, and that is the very challenging scenario in the case of the polycystic ovaries. The other health problems is that definitely as a female, the most important is the irregularity of the cycles. But don't get upset if your child or your young daughter having the irregularity of the cycles from the time of the puberty, because as a normal female, it takes 2 years for the cycles to get regularized. But even if after 2 years, your child or your young daughter having the features, so please don't delay it, go and see the doctor, and the doctor will guide you in a better way. There could be the consequences of the polycystic ovaries because of the weight gain, because of the issues with the glucose metabolism. There can be the chances in the long term of developing the diabetes, developing the cholesterol issues, and it's more common in some ethnicities, especially in the South Asian communities. This problem is very alarming already. The second problem is that it can cause the infertility in the future also. But don't get upset about it, because there is we can manage the condition in a very different ways, and that can help in prevention of the symptoms in the future and to prevent the complications in the future. So what you can do to prevent the polycystic ovaries and to manage the polycystic ovaries? So unfortunately, there is no cure of the polycystic ovaries, but like diabetes, like the blood pressure, like number of the health conditions, the people do a very healthy lifestyle. The people are athlete, even with the type 1 diabetes mellitus. Maybe you are not sure, but in the Pakistan, the Wasim Akram has type 1 diabetes, but he is managing his condition very well. So the basic cure and the basic key message to prevent the polycystic ovaries and to manage it is the very healthy lifestyle. And this is the very lucky month for us that we can improve our diet in the Ramadan, can have the more hydration, avoid the fatty foods, avoid the excessive amount of the carbs. You can eat fruits, vegetables, and try to have a physical activity. I know it's going to be difficult in the month of the Ramadan because we all get tired and have no stamina to go for a very strenuous physical activity, but at least try to be physically active as possible. Even if you can go for a walk for 5 minutes, 10 minutes, make a habit in the Ramadan, and after the Ramadan you can build up the intensity, and so that will be very helpful in the long term basis. The other aspect is definitely, if you go to see the doctor, they will prescribe the medications, they will give you the guidance that what medication will be better to control these issues, and there is a very good integrated healthcare support system, and we are lucky in the Australia that you can talk to the dietitian, you can talk to psychologists, you can talk to the exercise physiologist about the weight management, you can talk to the endocrinologist with the consultation of your general practitioner. So the number of the supports are available over here. But as a young, for the young girls and for the parents of the young girls especially, if they are having the polycystic ovaries, you are going to be their basic and the more core support system, because as a parents and as a family, you can provide the confidence to them that this is a condition, there is a cure for it, unfortunately not a cure, but we can manage it in a better way by and you can be the fighter for it by doing the healthy lifestyle, by doing the weight management, by doing the physical activity, and you can boost up their confidence that this is the health condition and that can be managed with your help and with the help of the health practitioners and with the support system in Australia.